Hi, good afternoon. This is our project titled Assessing Primary Care Provider Use of Guideline-Based Strategies in the Treatment of Patients with Asthma in Hillsborough County. This was done by Min Choi, Dr. Angela Garcia, Jennifer Marvin, Brittany Rollins, Molly Swingo. Our introduction is approximately 72% of patients diagnosed with asthma experience an uncontrolled asthma symptoms. There are clear disparities in treatment recommendations, diagnoses, assessment, and patient education among different practice settings. With Hillsborough County rated as an F for air quality, it is vital to identify the level of awareness and implementation of current recommendations from the National Asthma Education and Prevention Program Expert Panel Report 3 guidelines for the diagnosis and management of asthma in primary care settings. It is important to assess current asthma care strategies to reduce emergency department visits and hospitalizations associated with uncontrolled asthma.
Our primary objective was to identify practice strategies and resources used by primary care providers to optimize outcomes in patients with asthma. As far as our secondary outcomes go, we wanted to assess awareness of opportunities to optimize and implement care plans with validated tools, patient education, and self-management techniques. So our methods included a two-phase quasi-experimental study design. Phase 1 included validation of survey questions among priority providers and partners in asthma health management services and programs. From Phase 1, we were able to obtain feedback on question stems, answer choices, and verbiage to enhance inter-responder reliability and consistency. Phase 2 will include dissemination of our validated survey to our target population. Surveys will be distributed via email through a secure online survey software. Questions are going to be Likert scale, multiple choice, and free text formats. A cross-sectional analysis of qualitative data and retrospective analysis of patient outcomes data will be done. From this, we will be able to assess the implementations and awareness of guidelines and literature, diagnosis strategies, and management. We will also be able to assess the awareness of resources and tools to provide for patient education and disease state management.
All right, so I'm going to talk about the results. Currently, the results are pending, but hopefully once we gather the results, it will reflect the primary objective to identify practice strategies and resources utilized by primary care providers to optimize outcomes in patients with asthma. An association can be identified between awareness and implementation of guideline-based care plans by providers in Hillsborough County and ED visits or hospitalization rates in those same areas. As you can see in graph 1, which is a predicted result for correlation between guideline-based practice and emergency department admission rate, and each different bar represents different zip codes. So hopefully, as there's more resources and diagnosis and treatment and education that's based on guideline-based practice, there will be less ED admission rate. And looking at the graph 2, which is a predicted results for strategies utilized to improve asthma care, hopefully we'll get to see where the gaps lie between the resources that they utilize and what strategies can be implemented in order to maximize the guideline-based practice.
From our study, we have concluded that identifying gaps in best practices will support education and workforce initiatives by local and statewide asthma coalitions. Also, measures of asthma control as evidenced by the asthma outcomes correlate to levels of interventions needed to support providers to achieve optimized outcomes in their patients with asthma. And overall, the results of our study can provide additional opportunities for provider trainings and collaborations, including the integration of pharmacists. So in the future, we hope there is implementation of pharmacist-based services in targeted areas that will improve practice strategies and the reduction of emergency room admission rates. Thank you.